My name is Zhen Pei Hong. I'm an adult nurse practitioner and ASU DNP student now. I'm going to present my DNP 17 assignment 2. The topic is electronic health records and the Western Ontario and McMaster University's Osteoarthritis Index, WOMAC. Osteoarthritis is the most common arthritis. There are numerous OA patients come to seek treatment in primary care setting, and OA characterized by the progressive breakdown of articular cartilage, resulting in pain, deformity, and decreased function of back joints. So the joint can cause weakness and disabilities, interference with work, productivity, and insight, psychological issues dramatically increase overall burden on society and the entire healthcare system. I currently work in a primary care setting. Treatment guidelines published by American College of Rheumatology, Joint and Related to summarize osteoarthritis. The OA treatment, then, however, I need to monitor the effectiveness of treatment, therapy, pharmacology, joint therapy, and surgical treatment. Disabilities relate to the osteoarthritis. I knew all the data may have been monitored at somewhere in the current electronic health records, such as I currently work in a primary care setting, impressions or treatment of my patients. However, those data need to be looked through each time and visually remembering. However, I need to monitor the effectiveness. It is wasting my time, and the process makes me feel frustrated. And disabilities relate to the osteoarthritis. I knew all the data may have been monitored at somewhere in the current electronic health records, such as progress notes, vital sign portions, impressions, or treatment plan. But however, those data need to be looked through each time and visually remember what the track looks like. It is wasting my time, and the process makes me feel frustrated. What I need is a valid and reliable instrument to assess patients' health status and health outcomes in osteoarthritis. The Western Ontario and McMaster University's Osteoarthritis Index have been recommended by American College of Rheumatology as the most sensitive, condition-specific instrument for the assessment of intervention in osteoarthritis of hip and knee patients. And WOMAC contains 24 questions, including 5 pain questions, 2 questions for joint stiffness, and 17 questions for physical function. To ensure the effectiveness of treatment that I given, besides an instrument, I also need a system that is able to turn and aggregate the data into smart charts or control charts that indicate change over time. Additionally, the outcomes should base on the interventions that are given and demonstrate the disease progress overall. Although I have an excellent instrument to measure outcomes that relate to the OA, and a software to aggregate the data to a smart chart that demonstrates the effectiveness of treatment and disease progress. But I still consider that how can I monitor each time when patients come to a clinic for follow-up? Then I found out a clinical decision support system, CDSS, can be applied include alerts and reminds. Therefore, I plan to attach WOMAC questionnaire form in CDSS. The data collection sheet should be used to determine appropriate codes, such as CPT2 1006F. This code is for osteoarthritis symptoms and functional status assessment. So, which means as long as the code is established to the patient diagnosis, the WOMAC questionnaire form will automatically show in the patient's CDSS to alert provider to review patient's OA symptoms and functional status. Since the WOMAC can be used to monitor the course of the disease and to determine the effectiveness of intervention, and CDSS is designed to support healthcare providers in making decisions about the delivery and management of patient care. So, if the system can be set up, the benefits include easy to assess the effectiveness of intervention for OA patients, increase making decisions about the delivery and management of patient care. The third, increase compliance with clinical guidelines and standards of practice and regulatory requirements. The fourth, decrease the needless diagnostic image tests and prescriptions. The fifth, increase patient safety, quality of care. The final one, decrease healthcare expenses. There are 7 references including in this presentation.